Okay, step 26, cycle cancellation. Most IVF cycles go straight forward without cancelling the cycle, but in 5 to 10% of cycles, the IVF cycle may need to be cancelled. So in this step, I will explain the stages of cancellation and also reasons for cancellation in implications. So your cycle is documented as started from first day of your FSH injection. So if your cycle gets cancelled from the first day of FSH injection till the egg collection, that's called cancellation during ovarian stimulation. So there are two reasons for cancellation for that. One is clinical and other is non-clinical. So in terms of clinical reasons, it can be cancelled due to drug error. So for example, especially if you haven't given your antagonist injection, if you had a bit of error on FSH injection, it can be overcome by adjusting your dose. But if you missed your antagonist injection, so the period interval was more than 30 hours from your previous injection, then your cycle may need to be cancelled. Of course, you need to discuss with the clinic, and the clinic need to make individualized decision for that. And also you had a LH surge, so you had the antagonist injection without problem, but still you ovulated. You're ovulating because of surge of LH. Antagonist didn't properly block your pituitary, and you are surging LH hormone. So that can be seen on your blood test and ultrasound scan. Also, your cycle may need to be cancelled if you're having very high response, unexpectedly high response, which may put you at risk of having ovarian hyperstimulation syndrome. And the more common reason for cancellation is for poor response. When you had a stimulation of your ovaries and you had a scan on day 7, day 9 or day 10, then you don't have a sufficient number of follicles for egg collection. If you have only 1 or 2 follicles, then you can convert that cycle to IUI. You can have a trigger instead of doing egg collection. You can have IUI if your tubes are patent, if your partner's sperm is sufficiently good enough. Or you can do timed intercourse. You can do the trigger, then you can have intercourse. If your tubes are patent and partner's sperm is sufficiently good, of good quality and quantity, then you can just do timed intercourse with the progesterone support. So, and also your cycle may need to be cancelled for social reasons. For example, if you have any family emergencies, if you can't continue monitoring of your cycle or come for a collection, then you may need to cancel, or maybe cancel due to logistical reasons. For example, you run out of the stimulation drugs or antagonist drugs, or even trigger drug you don't have, and then that drug could not be delivered to you, then your cycle may need to be cancelled for that reason. Cycle may need to be cancelled on the day of egg collection, again for social reasons. You couldn't make it to the egg collection, or your partner couldn't attend for any social or professional reason. Although if your partner can't attend, you can go ahead with egg collection, and most clinics offer freezing of your eggs. And if that option is not there, then if your partner cannot provide sperm sample, if you don't have any frozen sperm in the lab, then your cycle may need to be cancelled. And your cycle may need to be cancelled due to logistical reasons. For example, you couldn't travel to hospital, or if there was some emergency in actually clinic itself, then they could not do the procedure. So, and also the cycle can be cancelled for medical reasons. For example, if you have some medical condition which can increase your risk of having problems during a collection. For example, if you have a chest infection or flu, you cannot have a general anesthetic for that reason. And also a common reason for cycle cancellation on the day of a collection is not following fasting instructions. You strictly follow your clinic's instruction for fasting for a collection. General instruction is you should not eat any solid for 6 hours before your egg collection, and you should not drink any fluid, preferably. So some clinics are allowed to drink clear water, just water, so it's clear plain water, until 2 hours before a collection. But again, you need to strictly follow your clinic's instruction for fasting, because it can vary. And also your cycle may need to be cancelled if you had the trigger injection wrong time. So let us say if you had a trigger injection too early, so that means by the time you do a collection you might have ovulated. If you did trigger injection too late, which means you need to your eggs will be mature later than the list. If there is a half an hour, 1 hour difference, usually your clinic adjusts your time of a collection. If that's an option, then you can still go ahead. But again, you need to tell the clinic if you had the difficulties with the trigger, if you couldn't give the trigger for any reason, or if you had a trigger wrong time. That's very important to tell, because if clinic doesn't know, if they do a collection, you may not get any eggs, for example, if you give a trigger too late. So that's why it's very important to communicate with your clinic and with your specialist if you had any difficulties with the trigger. And also your cycle may need to be cancelled after a collection on the day of fertilization check. So which means that when you check for fertilization, there isn't any eggs fertilized for any reason, due to sperm reason or egg reason, then you need to be your cycle need to be cancelled, and you need to speak to your specialist. So cycle may need to be cancelled due to a failed embryo development. You have embryos, but the embryos didn't develop to become high grade enough for transfer or freeze. So then your cycle need to be cancelled. So and cycle may need to be cancelled on the day of embryo transfer for social reasons. You couldn't attend the clinic for due to some emergencies, or logistical reasons, or progesterone progesterone you give too early or too late, because progesterone is very important to open your implantation window, and so that we transfer the embryo in optimal day for implantation. So if you, for example, started progesterone too late, then your transfer need to be cancelled, and your embryos need to be frozen and transferred in the future cycles. And common reason for cycle cancellation on that day is symptoms of ovarian hyperstimulation syndrome. If you have a bloatedness, abdominal pain, it's much safer to freeze your embryos and transfer in the future cycle, because if you get pregnant with the symptoms of OHSS, the pregnancy hormone, HCG hormone, can trigger off secondary OHSS. That's more serious than primary OHSS. So secondary OHSS means that you have a OHSS after the pregnancy. So for that reason, it's safer to cancel the cycle and freeze the embryo. You're not losing any embryo anyway, because your embryos will be frozen. Then you can have a transfer in future date. So and also you may need to cancel the cycle. You just decided to bank embryos first and get sufficient number of embryos in the freezer, then start transferring in the future date. So and that's called freeze all. So generally the cycle cancellation, especially if it's unexpected, if it can be quite stressful. So if it is expected, for example, if you have low egg reserve, your specialists may warn that your cycle may need to be cancelled if you don't have a high response. That's fine. If you're not expecting, that can be quite stressful. If you have any concerns, you need to speak with the clinic, speak with your specialist to discuss impact of your cancellation in terms of logistics, in terms of finance. So who will be paying for cancellation? Is the clinic going to cover cancellation fee, or your health insurance will cover, or public health will cover, or you need to pay cancellation fee? Usually there is some cancellation fee, because cycle monitoring is quite a labor intensive process for the clinic, and usually they charge some fee for cancellation. So and also impact to you emotionally. So so understanding reasons behind the cancellation, talking through the reasons with your specialists and the nurses is helpful in terms of reducing emotional impact and medical impact. For example, if your cycle got cancelled before the egg collection, for example, for risk of OHSS, then you will be ovulating, you may have some discomfort. So you need to discuss the implication of cancellation from medical point of view. So yes, cycle cancellations can be stressful, but understanding behind the cancellation and talking this through with your specialists and nurses is quite helpful in terms of reducing negative impact of